not a problem. We'll be sending you the video anyway. Okay. Well, then, Justin, over to yourself in a second. So this is your third one that we've done with you, and then if it's okay, can you just give us a bit of the setting the scene in terms of what's happened since since last week and where we are now and the kind of the movement forward?
Sure, thanks, Ricky. So I'll start off by just sharing some slides to give you a bit of an overview of the numbers, and then I'll talk a little bit about the where we are on the restrictions at the moment. So hopefully this will work. And let's go to slideshow. So basically, as you know, national restrictions will come into effect at 1 minute past midnight tomorrow morning. In general, what we're seeing is rates continue to rise across the West Midlands. Testing uptake has kind of stagnated in Birmingham. Overall, across the region, it's falling, which is of real concern. We are seeing an increase in hospitalisation, and I'm going to touch a little bit on that as well. And we are starting to see death numbers going up as well. So this gives you a sense of the overall position at the moment. There are 3 different kind of sets of data that I have to look at on a daily basis. The data on the left is from Public Health England, and it's the most accurate data, but it is also the most out of date. And that's because they cleaned out all of the repeat tests from people and brought it all together. But that shows that over the 7 days running up to the 29th of October, we were running about 273 cases per 100,000, and particularly this new indicator, which is our case rate in the over 60s, was running at just under 230 cases per 100,000. And that's probably the key indicator that government is going to be looking at over the next 4 weeks to whether the lockdown is successful or not, is how much that spread in the over 60s comes back under control, because it's very closely linked to hospitalisation. But what you can see is if you look at this weekly, and you remember when I met you a couple of weeks ago, I said kind of pick your day to look at the national progression dashboard. Don't look at it every day because you'll see it go up and down. But if you pick your day and look at the same day every week, you'll get a sense of the direction of travel. And what this shows that if you do that, looking at, I think this is every Friday, what you see is that testing rate has fallen, but the percentage of tests that is positive has risen. And overall, that means our case rate has risen. But the difference in our case rate week on week is getting less. And that's really what we're seeing is the impact of the restrictions that we've had for a couple of weeks already have started to bite and slow down the spread of the virus. But they're not turning that, slowing it down, but they're not turning it into a downward slope. And that's really what we need to achieve if we're going to maintain our NHS really being able to deliver what we need to everything and not just be consumed by COVID. This is a heat map, and the reason I just show this briefly is what it shows is the different rates across different age groups. And what you can see, Birmingham's up in the top left, is that we had a large number of cases in our 16 to 29-year-olds, and then we started to see increases in our 30 to 44-year-olds, and then in our 45 to 59-year-olds. So this purple band kind of creeps up across the age groups, and that's very much the pattern that you see in most areas actually across the country, and that's what people are concerned about. Now, it has been different in different parts of the region. So you look at Sandwell, for example, they didn't have that long lead in. They just escalated very, very quickly. But I think that's the bit that everyone is concerned about, is what's happening to that top row of over 60s, and can we try and avoid that going into the dark purple, because that will translate into hospital admissions and to death. I'll skip over this because it kind of just shows you direction of travel, but it's pretty much what I've said already. There is some variation across the city, but what you see, and what I'd say is focus on the map on the right of your screen, is that actually much of the city is a similar colour, and that actually that is that is kind of what we're seeing, is that it flits and changes a bit week on week, but in general, the whole city is moving in the same direction. Now, that's slightly different from where we were back in September, where we had many more cases in the Hall Green area of the city. So areas like Spark Hill, Balsall Heath East, Hall Green North and Hall Green South, they had a lot more cases than, say, areas like Sutton Vesey. But actually now what we're seeing is that's changing, and that across the city, everyone's moving in the right direction, in the same direction. Unfortunately, it's not the right direction. And you see this on the map on the left, where you look at positive tests across the city, that actually they're dotted all over the place rather than being concentrated in any one particular area. But what's good news is when you look at testing across the city, it's pretty even. So again, we're not seeing kind of areas where, and this makes it hard for me in a sense, because it would be a lot easier if we could say, well, actually, it's just people in Hodge Hill, for example, aren't testing. Well, they are testing, and they're testing to a similar rate as people in Oscott, for example. And actually that makes it almost more challenging to try and understand who it is that stopped testing, because we really have seen testing get stuck. And that's one of the key asks, I think, of Champions at the moment, is to really encourage people to get a test if they have symptoms, because it is the best way of getting this under control, is find out if you've got COVID and then isolate. And there is a much better financial package to support people now who do need to isolate. We've got testing sites. We've gone through these, I think, before with you. We're working at the moment to get another site open up in Erdington. And that's going through what's called the approval stage. So we'll see whether that comes through in the long run. It's all about negotiations with National. This graph just gives you the direction of travel. And I think this is the key bit about, if you look at the climb from the end of September onwards, what we see is a much flatter curve than the climb we had over August and September. So it was much steeper in these first two hikes than it was in the last one. And this is this long, slow hill we're going up. And that really shows that actually the restriction on household mixing that came into effect around the 15th of September has had an impact. I won't go into this graph, this bar chart in too much detail, but I suppose the key thing I want to highlight is the orange line, which is the 10 to 19s, is flattening out. The line that represents the 20 to 29-year-olds looks like it's starting to flatten out. And what we're actually seeing is quite a shift from this being about 20 to 22-year-olds, i.e. students. They're now dropping in numbers quite dramatically. And actually the increase is much more in 28 and 29-year-olds and working, and those that are more likely to be in work coming through. And this group that's 33 to 49 back up top of the league again. So, you know, we really are seeing this transmission in the workplace being a significant issue. Sadly, we've seen this green line at the bottom, dark green line, which is the over 80s, continues to rise. And that is not actually all about care homes. We're seeing rise in the community in our over 60s and in our over 80s, unfortunately. And that's really the kind of area that we're watching very closely at the moment. I'll skip over that one and the universities one. This graph just gives you a sense of some of the ethnicity differences. And as you can see, we saw flattening out of the rate in our Asian community. That's now started to pick up again. We've seen this continue rise that I think I spoke to you about last time in our white community. And now the rate in our white community is actually higher than our black community. And we're seeing at the moment that the testing rates seem to remain pretty constant, with our black community testing most, followed by our Asian and our mixed community, and our white community testing least. And so this isn't reflecting a change in testing behaviour. It is showing that actually there's now increasing spread in our white community. The wards change every day, and I suppose I put this up just to demonstrate that. So this is the 10 wards that the beginning of the week had the highest number of cases. And what you can see is day to day, this fluctuates. So if you look at the Sparkbrook and Balsall Heath line in the middle, one day was 5 cases, 3 days later there was 18 cases. Sometimes that reflects households, so the whole house testing positive. Sometimes it's about workplaces where 3 or 4 people in the same ward work in the same place and they've all got infected. And places have moved up and down. What I would highlight in this is you'll notice that Edgbaston and Selly Park aren't in the top 10 anymore. And that's really because we've seen the numbers, particularly at the University of Birmingham, come down massively in terms of student cases. And there's no evidence that actually that is because they're not testing. They seem to be testing at the same kind of rates. Touch briefly on death data. So there are 2 ways we look at death data. If you've got COVID on your death certificate, we get that data about a month later. And that's because of the time lag in people's death certificates going on to the national database. And the bar chart at the top shows that up to the 9th of October, which is the most recent data we have, the vast majority of deaths from COVID were in hospital. When we look at the other way of looking at death data, which is anyone who had a positive test from COVID in the 60 days before they died, and you count those. Now that, of course, means someone could test positive for COVID and be hit by a bus, and they'd still go into this number. And that's why all it does is it gives you a sense of direction, but it's not really an accurate number. And that's the graph to the bottom right of your screen, which gives you just a sense of the direction. And you can clearly see over October, the number of deaths have increased significantly. Just in terms of hospital data, and I'd ask you not to share these numbers, actually not to share any of this presentation outside. I've done it specifically for the champions to help give you a bit more insight of what's going on. But when we look at hospitals, we are seeing an increase in the admissions to our hospitals. And on average, hospitals like university hospitals are seeing around 30 to 40 patients a day coming in with COVID. We are seeing the capacity they have for their intensive care beds being used up. And that's what mechanical ventilation is. It's about saying in each hospital, there's a certain number of beds which they've got a ventilator attached to. Now, some of those beds are used by COVID patients and some of them by non-COVID patients. But what we're seeing is that in most hospitals, you would be okay and relatively relaxed if you were running at, say, 70% capacity. 80% capacity, you'd start to get a little bit nervous. Certainly at over 90% capacity, you'd start to be looking to stopping elective procedures. So surgery, for example, where you know someone needs to go into intensive care after their surgery for a day or 2, you may well stop doing that because you're not sure you're going to have those beds. So that's where it starts to impact on the way the hospital works. And what we're seeing across the region at the moment, most strongly in university hospitals, but it is our biggest hospital, is that the number of patients who are in COVID, who are in hospital with COVID, is increasing. They're staying in hospital longer, and that's because we've got better treatment, and they're not dying as quickly. We don't know whether they may well still die, but instead of, for example, in wave 1, where someone might get very sick, come into hospital and die 3 days later, now they get very sick, come into hospital probably a bit earlier because we've got better testing, so we know what's going on. They get better treatment and they stay in hospital for 3 weeks, and hopefully at the end of that 3 weeks they get to come out of hospital. But in the first wave, they would have died in 3 days and their bed would have been available for someone else. So what you've got is almost a kind of logjam developing in hospital now because we're much better at treating people. So that gives you a kind of sense of what's going on in hospital at the moment. And finally, this is some of the data that we present on a monthly basis to the Outbreak Engagement Board. And this is about the situations that we work with. So this might be schools, care homes, workplaces. And what you can see is last week, those numbers dropped quite a lot. And that was really because the schools were on half term. Because a lot of these where we have to give advice is around education settings. So we've seen that slow down, but I do think that's primarily the half term effect. And finally, in terms of contact tracing, at the moment, the data shows that for Birmingham, about 72% of cases are being reached by the National Contact Tracing Service. And that compares to about 79% nationally. And only about 53% of the contacts that are identified complete the tracing process. And that, again, is lower than the national picture. So I hope that's kind of helpful to just give a bit of a data perspective of where we are now. Obviously, there's quite a lot in there. And as I said, I'm not going to share those for you outside of this, but I wanted to give you a kind of insider view as champions to kind of the reality of the situation, and particularly of the hospital kind of context. National restrictions come into effect from tomorrow morning. The guidance is continually being updated. And I have to say, over today, there have been some significant changes. So you'll be aware, perhaps from the media, that the takeaways are now allowed to provide takeaway alcohol, which wasn't what it said a day ago. And there's also been some more clarity on things like going into people's houses to provide work like cleaning, and that is now allowed. So it's really important to have a look at the restrictions and just keep looking back at the website. And I put that link in the chat box for you as well. The other thing that I get asked quite a lot is about, what about shielding? What's happening about shielding people? So at the moment, there are no plans to bring back shielding in the way we did in wave 1. But there are some plans that the Department of Health and the NHS will write to everyone who gets, who they consider to be extremely clinically vulnerable. And in general, these are all adults, because the evidence is showing that children, even if they have existing health conditions, are at much, much lower risk of getting very sick with COVID. So there is a bit of a difference from what happened in the first wave. And that will be advising people to work from home if they can, and also where to get support. And the council will be having more information on its website about getting support as well. So I think that's probably what I was going to say. Shall I move on, Ricky, to start picking up some of the questions in the chat now? You're muted.
Yeah, no, that's fine. Justin, do you want me to answer? I'll ask you the questions if that's okay. So the first question comes from Majid, and I think it was relating back to some of the graphs that you showed early on in the presentation, which was in certain areas where the rates were up. And I think it's probably a mixture of a question and a statement, which was in particular areas like the Hall Green that you mentioned, was there a correlation between the Eat Out and Help Out scheme to those people who tested positive?
I think at the moment we don't know, to be honest, because I don't think there's any way of correlating who ate in a restaurant and whether they tested positive. I think there is a kind of general view that Eat Out, Help Out probably did mean that people did more socialization than they would have done otherwise, and that increased the transmission. So, you know, I would say that's a bit of a political one, but my hunch is it probably did have an impact, and I'm sure that will come up when we get to the public inquiry, but it's done now. So, you know, there's a limit to what I think it's worth mulling over. Okay.
Neelam here asked a question, which was, I think it was just been broken in the last day or so, which is Birmingham likely to have the random testing like Liverpool? I'm guessing it's like the mass testing.
Yeah, so what's happening in Liverpool is a pilot where everyone in Liverpool is being invited to get a test, and there's different ways it's being done. So some of it is they'll be invited to book a slot through a testing site, and that'll be a drive-through, a walk-through. I think some of it's going to be a bit of knocking on doors, so a bit like the drop and collect model that we had in the city. Some of it will be workplace based as well, and they are having support from the armed forces to do it. It is a pilot, and I think, and it is also consent, so people have to choose to take the test. It's not forced on them. You know, I'm very interested to see what happens. In Birmingham, when we had the drop and collect program, we're knocking on doors and offering tests. we had between a 10 to 15% refusal. So if people were in, the majority of people said, yep, I'll do the test. And we certainly found people who tested positive who'd had very mild or were very mild symptoms or asymptomatic. And there is some evidence that did reduce the numbers, particularly in areas like Spark Hill, where we were doing quite a lot of drop and collect, that Spark Hill's numbers really came down for a while. And I think that did reflect the fact that we were doing that extra testing. We will see. I mean, Liverpool is a pilot. There are no negotiations yet with any other cities about doing it. And obviously we're quite a lot larger than Liverpool. So I'm kind of waiting to see what happens on that one, to be honest. There are lots of questions, or not least that you would have to do it again. So you either do everyone in a week, which is, a huge logistic operation, or if it's spread over 2 to 3 weeks, which is what Liverpool looks like being, the people who tested on week 1, do you need to go back and retest them again on week 4? If it's too long a time frame, people might have then developed symptoms and test positive when they originally test negative. So I'd view Liverpool as a bit of a research study rather than anything else at the moment, but we'll see.
Okay. Majid has come back. I think this was relating back to the test centres that you highlighted. It was saying that he might have had some complaints that testing isn't available at the nearest test centre, but the test centres are actually empty.
So what we're being told at the moment from NHS Test and Trace, who run the test centres, is that there are appointments available and people can get postal kits as well. There isn't that control with the website being turned on and off like there was about a month or so ago. But what I would say is that sometimes one testing site is closed for whatever reason. That might be staff sickness. It might be there's been something broken, whatever reason. So I wouldn't trust eyeballing it, to be honest, about whether it's used or not. But, people will be offered the test site that is closest to them. It will differ if they drive. If you say you've got a car, you'll be offered a drive-through site. The majority of those in the city at the moment are in Aston, although we're working to open one up down in Longbridge, hopefully next week. Or there's the big regional testing drive-through site at the airport as well. If you don't have a car, then you'll either be offered a postal kit or a walk-through site. And the walk-through sites, it's generally about a 2-mile radius. You're offered one in. And they, on average, have about 200 appointments a day. So, if you don't get an appointment there, then I would say get a postal kit rather than waiting till the next day. But in general, what I'm seeing is that they're rarely getting over about 80% capacity. So there normally should be slots. And it may just be a case of try again in an hour. If it's still saying no appointments, order a postal kit and just get on with it, I think.
Okay, Justin, this is from Pamuria. She's saying that she's at work, they're receiving obviously students who have had a vaccine in their home country. However, our approach is to still ensure 14 days quarantine on arrival. Would this be a sensible approach?
Absolutely. So at the moment, there are no vaccines that are approved globally. And no one's actually proven a vaccine that works yet. There are lots that are in the final stages and in final stage trials. So even the Russian one that I know the Russian president made a lot of noise about was still in its final stage trials. So as far as I'm aware, no one's got a vaccine that's got through that final stage. So anyone who tells you they've had a vaccine, they must be part of a research trial. Or they've been sold a bit of a dud, frankly. So treat them as if they're no different and give them the 14 days quarantine.
Okay, thanks, Justin. Sarah Turner, hi, my question is, the new national regulations state that support groups can continue with up to 15 participants. Could you give us a bit more clarity around what does and what does not constitute a support group?
Yeah, I'm just trying to get up the actual wording for you because it is quite an important point about some of the wording is really key in this. But what I would say is, in general, a support group would be something like one of the 12-step programs for someone struggling with addiction. There is, in the definition, legal definition, there is specific phrase. Let me just pull it up because I'll get it in front of me if I've got it. So things like addiction support groups, mental health support groups for lesbian, gay, bisexual and trans people, victims of domestic violence and abuse. So in the regulations that we saw a draft of last night, that have been passed by the House today, there's a very kind of specific list of the example. What I would say doesn't constitute a support group would be something like a knitting group or a running club. That's not a support group in the kind of the spirit of the law. So I would say in the spirit of the law and the regulations, support groups are for people who have particularly psychological and mental health needs for support. And of course, these groups have to have all of the risk management and the risk assessments in place before they meet.
Okay, Justin, we've had somebody, we've had Jane Clark. Justin, can you clarify regulations which allow a place of worship to be open to broadcast an act of worship? Is more than one service leader allowed to be present? Is a small group or socially distanced musicians and singers allowed to be there to record the broadcast?
I love it when you go for the really detailed questions on this.
Yeah.
So my read of this at the moment is that it really is talking about the smallest number of people possible to be able to broadcast the act of worship. So think of, what did you do in June or in May before we had restrictions relaxed? That should be your starting point. Basically, go back to what you were doing, or in the very first stages of relaxation. At the moment, I don't think performance singing is allowed. Or there are some exemptions for rehearsals, but not for performances. And there are some exemptions that I've seen around recording things. But what I'd say, look at the guidance probably tomorrow, because I don't think it will be all there tonight. And there'll be some guidance specifically performance art, which would tell you what to do with the musicians or the singers. And I think for the broadcast of the act of worship, the fewer the number of people, the better, because ultimately what we're trying to do is stop the spread of this virus. And the more people you have in the room to broadcast the act of worship, the bigger risk that it will spread in that group. So, you know, go back to what you were doing in the very early days when we were back in restrictions over the summer. How did you broadcast, and use that as your kind of starter for 10?
Okay, I'm going to try and summarize a few of these, because otherwise we're going to get a list of questions for Justin. We might run over. So this is from Zhu Zhang. She's from Chinese community, basically asking about how are the NHS prioritising the BAME community in terms of priority as treatment beds and ventilators, and asking, is herbal Chinese medical and alternative treatment shops allowed to be open during the lockdown?
Okay, so let me take those in reverse order, if that's okay.
Sure.
So no, I don't think Chinese herbal medicine or alternative treatment shops are allowed to be open. I don't think they are considered essential provision. But again, I would say check the guidance tomorrow, because it's most likely to be completely up to date tomorrow. But in the current version I've seen, they're not in the list of shops that are allowed to be open. In terms of the NHS provision, the NHS remains open, and at the moment what I would say is that the NHS is starting to struggle, but it's okay. It's just starting to struggle, and it's kind of saying, this is why you've seen people like Simon Stevens, the chief exec of the NHS, saying, look, everyone needs to take this seriously. You know, we really need to stick to the guidance for the next 4 weeks, because if we don't, what we will see is increasing number of COVID patients in hospital. And in winter, normally we see people going into hospital more anyway. And there are only so many hospital beds, there are only so many doctors and nurses. And even if we open the Nightingale, and the Nightingale still needs to have doctors and nurses staffing it, and they have to come out of the hospital to go into the Nightingale, there isn't a kind of magic extra set of doctors and nurses sat around twiddling their thumbs at the moment, then we're going to be in real trouble. And that's where you start to get to a position where hospitals start to have to make decisions about who gets the bed and who doesn't. And you know, hospitals have always been able to do this. Back when I trained in medicine, you know, there was that you do this kind of ethics class about how do you make the decision if you only have one ventilator machine and you have 3 patients. How do you make the decision on who gets it? And so in hospitals, they tend to have a model called 3 wise men, where it could be 3 wise women, but there are 3 senior clinicians whose job it is on any given day to make those decisions about resource allocation. Now, the hope is we never have to get to it, but these were things that were all developed actually when we were looking at the millennium, at the Y2K bug. And we, you know, back when I was working in hospital at the time, we all had to think about, we'd have to go manually ventilate people because the machines would break down, and then you'd have to make all these decisions. So there is thinking in the NHS about how to do that, but we're quite a long way off that. And if everyone does what they're asked, then it will come down. I think one bit I do want to just say in this point is it is really important that we get the message out the NHS is open, and that people who've got health problems should reach out to their GP, should call an ambulance if they're seriously unwell. You know, in the last wave, we saw a real rise in people dying from things they didn't need to, bluntly, because they sat at home and they were worried about worried about catching COVID, worried about all the rumours that were going around the NHS. So they sat at home and got sicker and sicker. And eventually, when they called an ambulance, it was just too late. So, you know, please encourage people. The GPs are now doing a lot by telephone. If they need to see you face to face, they know how to do it safely. But, you know, please encourage people to use the NHS, because we really need people to come in sooner rather than later. And the same's true for COVID. You know, don't sit at home going, oh, I'm not feeling great and it feels like COVID, but I'll give it another couple of days. Get a test. And if you start to get worse, get in contact with your GP and get help, because the sooner we can treat people, the better the outcome.
Thanks, Justin. The next question is from Beck. So thank you, Steve, for giving some of the daily updates around guidance. That'd be useful. Beck was just talking about the Nightingales, and I think you just touched it in terms of like when that's probably going to come into effect. Fine asked a question around citizenship ceremonies. I think we probably have to just take that question away and find out a little bit, because that's quite really specific and not necessarily our department, unfortunately. So I'll take that. We'll take that away for you. Bosman and Diana says to Justin, when somebody returns from overseas and needs to self-isolate in a house where others live, is the person allowed any contact with any of the other members? He's been living in that household, or do they have to live completely separately from others in the household?
So it's a really important point actually about self-isolation, because it's the same for someone who's got contact, who's identified as a contact or identified as someone as a case. If you are isolating, that means and you share a house with other people, you basically should stay in your room as much as is possible. Obviously, you'll need to use a bathroom, unless you have the luxury of an ensuite or your own bathroom. You need to be really clear when you're using the bathroom, and that it's cleaned down before anyone else uses it. So that's wiping down taps, toilet seats, showers, taps, all of those bits and pieces, because that's where transmission can happen. You need to avoid being in a room with anyone else. So you can't all sit on the sofa and watch TV together. So yes, it does mean you've got to avoid contact as much as possible. There is some evidence coming out of America at the moment that says if someone in your household is positive, then it's probably wise for everyone in the household to wear a face covering, even inside the house. Because obviously there are points when people might come out of their room, and that can increase the risk. So actually there's some evidence that if someone in your house is positive, then for the 10 days while they're isolating and you're isolating as well, you don't all get to sit around on the sofa. You should all be wearing face coverings, and you should avoid being in the same room with the person who's positive. So hopefully that kind of makes sense.
Okay, I'm gonna kind of skip and preempt the question around Christmas. So there's one around, are there plans of rapid testing for universities before they go home for Christmas? And generally, what's your feeling in terms of the lockdown? Do you reckon we will go into towards Christmas?
Yeah, so there are plans being developed about what's called test and release, which is plans on how we might be able to test students before they went home at Christmas. We've got a couple of weeks yet, and some of it will depend a bit on getting new technology coming through. And some of what's happening in Liverpool at the moment is testing some of the new rapid result kits that give a result in about 25 minutes. But they're not easy to use, and at the moment you do need someone else helping you to use them, so it's not quite as easy as doing a pregnancy test, unfortunately. But there is planning for that. In terms of Christmas, it will depend a lot on what people do over the next 4 weeks. If people really abide by the restrictions, then we will see the numbers turn down. There's some hopeful signs from Liverpool that actually who one of the areas that went into tier 3, the higher level of restrictions earlier, that they are starting to see their case numbers coming down now. So if we all abide by them and the case numbers start to fall, then I think there's a good chance we will get out of this in December. Whether it will be the 2nd of December or the 20th of December, I'm less confident about. And it does really depend on how good everyone is at abiding. If people go, well, this doesn't matter, and I'm going to go and see my mum, or I'm going to meet up with a group of mates in the park, and we see case numbers continue to rise, then there's a real chance that we will stay into this all the way through Christmas into the new year. So, it is really about what everyone chooses to do over the next 4 weeks. And, at the heart of this, your decisions put yourself at risk, and they put your family and the people you care about at risk. And that's what we're dealing with. It's not about what happens to someone that lives on the other side of the city. It's about what we all do in our own lives that impact on the people we love and care about.
Okay, Justin. Pam has sent in a question saying that she read a report that transmission is 80% from asymptomatic cases. Is this the case? And if so, are we missing all those by urging people to test if they have the symptoms? Will the new tests overcome this?
So I haven't seen that article, Pam. I know that the majority of the evidence at the moment says that people who are asymptomatic are less good at transmitting the virus than people who do have symptoms, and to some extent that makes sense, because you're more likely to have symptoms if you've got more virus in your body, because you're basically, your body's fighting the virus, and that's why you get the temperature, and that's what produces the cough, etc. It's about your body fighting the virus, and generally people who have more symptoms have more virus, and if you have more virus, you're more likely that when you're coughing or breathing or shouting, that the droplets you spread have got more virus in them, and that's more infectious. So the theory is that asymptomatic people probably aren't very good at spreading it. Now, what we are seeing is in the studies in care homes and in hospitals, that there are slightly more asymptomatic people than we previously thought. But they don't seem in general to be, as I said, very good at spreading it. So we are seeing more asymptomatic people identified through some of the research, but they don't seem to be the great spreaders behind this. And there was some stuff, you remember, I think probably about 6 or 8 weeks ago in the paper about super spreaders. So some people are really good at spreading it and most people aren't. And that does seem to link up with symptoms as well. The new testing, I think, will mean we'll be able to test many more people. And there could be a version of the world in which we all test once a week, and it just becomes part of what you do normally. But that requires millions of tests a week, and millions of testing kits. And at the moment, we just don't have that capacity. But it is certainly some of the stuff that will come out of Liverpool where they are testing people without symptoms, and finding more and more about what's going on. So I think it's a case of watch this space.
I'm just going to ask to put a hold on the questions now, because otherwise we're going to really spill over. So Justin doesn't know it yet, but we've booked him for another session early next week. So there you go. Okay, so this one's from Anonymous. So thank you, Anonymous. This is somebody who's working with local mosques within the community, and a couple of points. One is that if the mosque is willing to set up their site as a community testing centre, how do they do that? And if they were able to kind of distribute some of the kits on behalf of the NHS and BCC.
Yeah, so what I would say is, Anonymous, please email Ricky and Habib and tell us who you are, and we can pick up that conversation offline. Now, at the moment, there isn't a lot of flexibility in testing sites. And the big problem, to be honest, is that the national testing system requires the site not to have a carpet if it's indoors. And that rules out a lot of our face settings. Also, a lot of our kind of banqueting suite places tend to have carpets, and that's the problem. But with the new technology, that might change. So we'll see. But I'm afraid you'll need to come out of your anonymous shell and tell Ricky and Habib directly who you are.
Yeah, I've just put my email address on there, so we can still try and keep it anonymous the best we can. Okay. So this is a good question in terms of like the new national restrictions coming in on Thursday. Is there plans for anything additional for being Birmingham specific? I know this was the conversation for Tier 3. Is that likely to be something similar for the national guidance?
No, the national guidance is the national guidance. Everyone across the country in England has the same rules. There are no little tweaks locally. On the other side, when we come out of this, that's where it's likely to be different. But for the next 4 weeks, you do the same thing as people in Coventry, London, Manchester or Newcastle.
Okay. Beck asked a good question relating back to your presentation, which was about test and tracing, that there was a 53% in compliance in finishing the process. What are the barriers, and what do you think we can do to try and encourage people to complete the whole process?
So I think the barriers are, one, it's a bit about trust in this system. And I think reminding people this is the NHS, and it's, although they're using some call centres and stuff, that's no different from 111. When you ring 111, it's exactly the same kind of model. I think, there were some issues to begin with about language, but they now have instant access to translators. So that's improved things as well. I think there is a bit of a concern that people are worried that, if they give all this information, then other people won't be able to go to work, and that has a financial impact. But I think that the new financial aid and support to people when they're isolating actually is working really well. And the council has, responded to thousands of people in the last week actually who've reached out for that support, and got the money to them quite quickly. So, I think it's changing, but I think a lot of this is about trust. And I think that's where, as champions, reminding people this is about protecting the people you care and you love. If you don't tell people they've been exposed to COVID, then they won't know. And if they do develop symptoms, they might go, oh, it's nothing to worry about, and infect their whole family. They might infect their granny. The more you can give people the awareness they've been at risk, the better the outcome for them and the people they love and care about. Okay,
this one from Alice and Lily. Is it true families will now be able to visit their relatives in care homes and supported living? And will there be any money to help this happen? For example, these visiting pods, or will it be down to individual homes to fund?
Yeah, so we're expecting new guidance on visiting probably tomorrow. Although knowing the Department of Health, it'll probably come about 10 o'clock tonight, and then be in place for tomorrow. The guidance I expect will say that care homes have to take or make more detailed decisions about essential visiting. And there are different ways that might be offered. So it might be window visiting, might be a visiting pod in the garden, as Alison alludes to. There is a specific funding stream that supports the care homes around what's called infection prevention, and I would expect them to be able to draw on that for anything that they needed. But we'll see what the guidance says. I mean, it's been many, many months coming, and I've been lobbying for it for pretty much since August to get clearer guidance on visiting, because obviously when we went into restrictions, we stopped all care home visiting in line with the national advice. And we really wanted some advice on what could we do safely, even if it was just window visits. So I'm really keen to see it. But it won't be that you can then go visit from Friday. It will take the care homes probably a week or so at least to get the systems up and running safely.
Thank you. Catherine, we've discussed about the Nightingale already, so apologies if you sent that in advance. Carol Gordon. Okay, so this is a kind of a common scenario as well, is so Carol's given a scenario is that if her husband tested positive and she isolates, but she might be the source of it because she may be asymptomatic, any talk of testing all contacts, even if they've got no symptoms, so that if they're positive, do their contacts be traced?
So the answer at the moment is no, we're not testing contacts of cases unless they develop symptoms. Now that might change as more testing becomes available. Although we've got testing slots available, there still is a limit on the number of tests that the system can do every day across the country. And if we tried to test all the contacts, then that would be, it would overwhelm the system. The other issue, of course, is, well, which day would you test the contacts? So if you test it in the scenario that Carol sets out, it's only really worth testing the contacts on day one to see if they were the source of the infection. You're not going to actually be confident on whether they have or haven't caught it off the case, probably until about day 8 or 9, because some people will catch it, but they won't test positive for about 4 or 5 days after they've caught it, because the virus is still growing in their lungs and not really, they're not spreading it, and it's also not detectable yet because it's down in the base of their lungs. I know it's something that's being thought about from the point of view of if you tested people on day 8, might they be able to get out earlier? But I think at the moment there probably isn't enough testing capacity at the moment to do it. And I'm not sure it's a huge amount of value, but we will see.
Okay. I'm going to shoot through these. Can people travel? Sheikh Mohammed basically says, can we travel to other countries for holidays?
No.
Okay. Next one is Dorrit. Some parent groups or drama group sessions for young children are being told they're still able to run private groups. Is this the case?
Right. So the guidance on what you can and can't do for children is about saying that you can provide childcare, and that is in order to allow parents to go to work or to study. If it's not provided in that sense, so you're running it because it's an after-school club, for example, at say 7 o'clock at evening, that would not fit the exemption. So the exemption is only actually in the context of providing childcare support so that parents can go off and do their jobs, basically. So it would depend on the timing of the day. And really, you've got to start with, do I need to do it? Could it be done virtually? And if I am going to do it, can I justify it? Can I demonstrate that the reason to do this fits the letter of the regulations, which is around providing support for children so their parents can work or study. That's the current wording of it. Or is it to support young people, young children who've got mental health issues, for example? So then it comes under the support group exemption.
Yeah, I think you just answered Andrew's question as well. So around the support bubble and the structures of grandparents allowing people to go to work for childcare.
Yeah, so the support bubble for childcare is the same as it was 2 weeks ago. And the same is true for the social bubble. So social bubble and childcare bubble haven't changed, and those exemptions still apply.
Okay. This one goes to the track and trace app. I'm just going to let everybody know we've got about 8 minutes left, so we're going to have to shoot for this. The track and trace app, does it have any element of enforcement to it? Are text messages sent to people? Will they be fined if they're still going to areas?
Okay,
Yeah.
so the test and trace app sends you reminders saying you should still be isolating. But it doesn't track you in terms of if you're traveling. So it doesn't unlock and follow your GPS and go, you're not at home, therefore we're going to fine you. That's not what it's about. It's, but it does send you a little countdown if you're isolating, how many days to go. The council is writing to everyone who tests positive to say you do have to stay at home and there is a fine if you don't do that. And we will be calling you at some point during your 10 days of isolation to check you're okay and offer you any support. The letter also includes the information on the financial aid that's available as well. And we have had people reported to the police, who are the enforcement body, by relatives and friends who've dobbed them in when they should have been isolating, and the police have taken action.
Okay. Magdalena is talking about the Polish consulate being will continue to see clients through the lockdown. Is that specified exemption from the rules for consular services and immigration welfare support and service meetings places?
So I'm not sure, to be honest, Magdalena. I've not seen it explicitly, but I would imagine it would be. And I think that would come under the exemption, which is a bit like there's an exemption for providing social care and benefit welfare support meetings. So I would imagine it would come under that exemption.
Alison comes back. Should GP surgeries be operating as before the 5th of November? So I think we've only got a day anyway.
Yeah, so they are operating. Most of the GP practices since the last round really moved to telephone triage, where you get called and you have a conversation with the doctor. Doctor decides whether you need to come in or whether you can have a consultation by phone. So there shouldn't be any major difference from what's happening today.
Okay. Neelam, I'll take your question separately. So thanks for that. I'll just register it. Farhan, we'll find out a mechanism of responding to your earlier query as well. Carol just talks about germ defense resources, which is fantastic, which we send out regular. This is from Ante, which is, what is the current guidance around police officers wearing face masks when entering a resident's home? Oh, you're on mute.
Sorry, not sure on that one, to be honest. I think we'll have to, perhaps through Habib, pick that up with police colleagues on what the guidance is. In general, anyone who's coming into your home for a work reason, so whether that's to fix your boiler or to interview you or anything else, should be wearing a face covering. I would also advise that if you've got someone coming into your home to fix your boiler or for any other reason, you should be wearing a face covering while they're in your home. And you should make sure you're keeping that 2 meters distance. Now, there are obviously going to be some rare situations where that's not appropriate. So, for example, social workers working with vulnerable children, and they need to be the child needs to be able to see their mouth and their face, and a face mask would damage that relationship. But in general, rule of thumb, if you're going into someone else's house for work, you should be wearing a face covering, and everyone else in the house should be wearing a face covering to protect the person coming in.
Thank you. Let's just have a look at it. Yeah, I think there's just a couple of bits around the app in terms of like notifications if people are getting positive with some kind of false kind of notifications. Is this something that's, I know it's been mentioned that this is kind of an ongoing thing in terms of development. Is that fair to say as well, Justin?
Yeah, so it is a kind of, we've never done this before. So, we've got to recognize it is a relatively new bit of tech. And one of the frustrating bits about the app is it doesn't tell you where you might have been exposed. And I've certainly had those notifications which go, you have been identified, you might have been exposed to someone, and then 5 minutes later it sends me something going, we've assessed the risk and you don't have to do anything. And I'm going to go, oh, that's really interesting, but it would have been nice to know where that exposure happened, you know, and pick that up. But it doesn't do that at the moment. You know, if it tells you to isolate, you need to isolate. You know, and that's the important bit. But often what it does is it tells you be near someone and then says, no, you don't need to worry. So, you know, you look for that second one. If the second message doesn't come, assume you don't need to isolate. If you do, it should come out very clearly and tell you.
Okay, I'm gonna the last question. I think some of the questions before that have already been answered. So it's Panmuria, which is, there's a great deal of anxiety and fear, as you can see on the TV and it's surrounding news everywhere. Are there any plans to share kind of small wins and successes?
Yeah, I think that's a really good challenge to us. And I'll have a think with Ricky and Habib and the team about how can we help give you a bit of good news stuff as well as all the bad news, because it's often really, you know, that is helpful. And we have seen some really good examples where actually we've had cases in workplaces, and because the workplace has done all the right things, it hasn't spread. We've seen a lot of that in schools, actually, that the spread hasn't happened. You know, it's always really difficult to kind of give people that it's good news that a bad thing didn't happen. People don't get particularly excited about that, other than me, where I'm quite excited about cases not happening. And certainly the work we're seeing in the universities is some really good news stories, actually. You know, we're looking at, in one of our universities, they've gone from about 250 cases in a week now to only 60 cases in a week. And that, I think, is brilliant news. It really reflects all the hard work that's being done.
Yeah. Okay. So we'll work with you. We'll work with everybody in terms of trying to get that done and give you some of the updates or anything that was outstanding. We'll set that through. But I'd like to take this opportunity to thank Justin for this. Obviously, as we've always said, we've tried to be as organic and transparent as the best as we can. I really appreciate it, and you know, a big thank you to the way that that you guys are, and we can see the positive work. So a small positive one is now we've got over 400 champions now within the city, and a lot of other councils are approaching us in terms of asking us, how we're doing things. So in the near future, we're still working on a sharing Dropbox facility that we're trying to share resources. We'll be sending some updates out as well. So anything that is key highlighted, we're able to send via text, we will do. So I expect quite a lot of information coming your way in the next couple of weeks, if that's okay. And eventually we're trying to sort out the WhatsApp bit, and this will be a kind of a direct way of bringing back to us. Another thing that we're thinking of doing is seeing if we can try and get everybody, a few of you guys together as a bit of a meeting, and then we can just kind of facilitate in discussion in terms of like, how do you see this moving forward in the next coming months, especially over Christmas, where we might need to pull on each other a little bit more as well, and going into the new year. So thank you to everybody. Next week's one, we're trying to arrange for Tuesday a little bit earlier. The week after, we got some of our we've got our education colleagues coming in who are going to be doing a Q&A also, and so we'll do this weekly, and hopefully you'll get some of the feedback coming back as well. So thank you everyone, and have a good evening. Thank you. Bye.
Thank you. Bye-bye.